treatment for it is usually what if it turns out to be, whether it's basal, squamous, or melanoma? Where do you break those down?
Well, melanoma is the standard of care is to do surgery, and in the United States, that's universally accepted unless there's a medical contraindication to it that would be done. In Europe, they often use radiation up front, and the results have been pretty good. But here, for sure, I would just offer surgery. For squamous cells and basal cell carcinomas, it's really a decision that the patient has to make in conjunction with the doctor, because a lot of times there's a cosmetic issue with surgery. The patients are on blood thinners. It may be in an area where it can cause significant difficulty in healing. It could be, for instance, below the knees. Most elderly people have vascular compromise below the knees, and therefore if they have a cancer removed, they might have significant healing problems. Also in areas of thin skin, they could have problems maybe like in the back of the hands or on the scalp. The other thing is in areas of the face, for instance on the lip, the surgery could cause a distortion. They could have trouble with their eating, stuff like that. And also in certain areas by the nose, it tends to be a deeper area than it appears, and therefore surgery could be quite debilitating.
So, if at all possible, try to avoid surgery and maybe do radiation therapy for cosmetic reasons alone?
Well, cosmetic reasons, usually we will get a better cosmetic result than surgeons. A lot of people are not going to be so concerned about it. They want what they call convenience of surgery, assuming everything goes right with surgery. But not everything always goes right, and especially if you're getting radical surgery like Mohs surgery, they can take hours, and then there might need to be a closure, which can take hours. So the radiation can be much easier for the patients, and really the best thing to do is get an opinion. Then the patient can make a knowledgeable decision.
When you're dealing with melanoma and you have surgery, do you usually follow up with radiation therapy?
Not necessarily. It really depends on how good the margins are, and whether there's a suspicion that there could be some spread nearby.